Let me ask you about the rest of the world, which, of course, particularly the poorer countries are going to be hit hard for all kinds of obvious reasons. They don't have as good a healthcare system and things like that. Now, I've read as a result a couple of very interesting analyses that say, look, for these countries, there's a real question about whether they should be going for a full lockdown model because first of all, many of them have people living in slums which are very tightly crowded. I grew up in Bombay. There's a slum there called Dharavi, which I'm sure you visited, where the density of people is 800,000 per square mile. To compare, New York is 27,000 per square mile. So actually, if you send those people to work, you're helping them socially distance themselves. It's by staying at home that they are, become kind of living in petri dishes. There's also the fact that it's warmer, they have fewer old people, that for that reason, poor countries should really be thinking about this differently.
Yeah, I think that's right. This is, to me, one of the greatest uncertainties is the reported cases coming out of developing countries, whether it's India, Pakistan, Nigeria, Sub-Saharan Africa. Those case numbers are still fairly small. Now, we've funded ramping up that testing capacity, but it's still limited. There are reasons people might not want to come forward to volunteer to be tested. The initial spread is probably more amongst the international travelers. That's a fairly narrow group of people. But sadly, unless there's some magic positive factor we don't understand, eventually the slums you're talking about will experience very widespread infection. And the social isolation measures probably can't get the reproductive rate below 1. And people need food, and if the government tries to overdo things, you'll get riots, starvation. You could have a complete collapse in civil order if you're not careful. So I do think the creativity of how you reduce the infection rate while making sure people still get food, that's really an unsolved problem. It worked for the rich countries with that gigantic economic price, and it might not in these countries.
And how do they get out of it economically? I mean, the United States at some level can print money. Most of these countries have to borrow. They have to borrow on international markets. It's much, much harder. What happens here?
Well, I'm afraid a great deal of hardship. Even things like routine vaccination, the rates are going down, and that alone will account for a lot of deaths. The measles campaigns that are important, we've been modeling out what it means. So, things at the basic level of very basic healthcare, very basic sustenance are much tougher. And so sadly, as is the case in most bad situations, the poor countries and the poor citizens will be the ones who bear the brunt of the burden. And all the more reason that the world should get the billions to build the tools and get those tools not just to the countries who finance them or have the great scientific and manufacturing capability, but get them to the entire globe.
You've been making this case for international cooperation very powerfully and, to my mind, persuasively. There is right now in Washington a very different mood, which is to say, far from cooperating with the second largest economy in the world, it is China that is to blame for this virus. You've been following this very carefully. How would you respond to the charge that, look, the Chinese covered this up, they've essentially deceived the rest of the world, and as a result, they should be held in some way responsible for this?
Well, I don't think that's a timely thing because it doesn't affect how we act today. China did a lot of things right. At the beginning, like any country where a virus first shows up, they can look back and say where they missed some things. Some countries did respond very quickly and get their testing in place, and they avoided the incredible economic pain. And it's sad that even the U.S., that you would have expected to do this well, did it particularly poorly. But it's not time to talk about that. This is the time to take the great science we have, the fact that we're in this together, fix testing, treatments, and get that vaccine, and minimize the trillions of dollars and many things that you can't even dimensionalize in economic terms that are awful about the situation that we're in. So that's a distraction. I think there's a lot of incorrect and unfair things said, but it's not even time for that discussion.
You've worked a lot with the WHO over the years. What do you think of the charge that they didn't push back hard enough, or maybe were even complicit in China doing a certain amount of deception and not revealing everything? China did not give WHO the access that they should have, also the CDC. Do you think the WHO is culpable?
Basically, no. I mean, in the retrospective, we'll see things that WHO could have done better, just like every actor in this whole picture. But the WHO has a strong connection with one country. That country is the United States. The number of CDC people who are there, or people who used to work for the CDC, there's no UN agency more connected to a country than WHO is to CDC. People think WHO is funded to do all sorts of things that their tiny little budget doesn't let them do. So they're a thousandth. Their budget is a thousandth of what's spent on healthcare in the US. They don't invent vaccines. They don't understand vaccine factories. But what they do is very, very important. The eradication of smallpox, the progress on polio eradication. It's a phenomenal organization that we're more dependent on them today to drive things than we ever have been. And so, we need to support them, help them, and, at the right time, think about, for pandemic 2, how should all of us do a lot better?
You have been caught up in this controversy where you and Dr. Fauci are the targets of a certain, kind of right-wing campaign saying you guys are in some way part of a conspiracy. Does it bother you? Does it affect the way you need to do your work?
Well, there's a certain irony that, having put a lot of energy into trying to warn about this vulnerability and not getting much investment to be made, sadly, I always think, how could I have gotten the message out in a stronger way? Where did I fall short? Because only 5% of what should have been done was done. The irony of having that person be accused of creating the virus, seems a bit strange. I don't know that a meaningful number of people believe that. It does kind of get amplified. There are people who want to view this through a political lens, not a scientific lens, and that can lead you to some strange views about let's not speak the truth or look at the real numbers or compare countries in a rational way. But hey, we've got to get our heads down here and look at these therapeutics. A lot will fail, but some of the ones that are less celebrated, I'm very hopeful for.
Bill Gates, always a pleasure to have you on. Thank you so much.
Yeah, thanks. That was great.